Good morning, everyone. Welcome to the panel discussion on protecting migrant rights and amid the pandemic downturn, organizing by Mekong Migration Network. As we know, the panel discussion today will look at how the COVID-19 pandemic is having on the unprecedented impact, as we know, to all of us in the world, but also migrants in Greater Mekong sub-region in GMS are among the most affected, giving their limited access to the social protection and social cohesion, but also lack of the job security and their very precarious immigration status. Mekong Migration Network has been conducting the collaborative research on the impact of the COVID-19 on life decision making by the migrant themselves, on what kind of decision they're making when the pandemic affecting their decision. So the panel discussion today will address some of the questions and the thematic. Number one, as I said, we want to look at what decision have migrants who still in Thailand, but also the migrant returnee back to the country of origin and their families made in the light of the COVID-19 pandemic. Even Thailand have a little bit better off situation than the other country around us or the world, but also some affected of this pandemic on the life of the migrant. Number two, what policies have the Thai government implemented to provide labor and social protection to migrants during the pandemic, including their family and their community. Number three, how have the country of origin assisting their own people, nationals, which is the migrants and their family who impacted by the pandemic in Thailand, because this is a cross-border migration issues. And number four, which is the last but not very least, is what can be done to strengthen labor and social protection for migrants in both and the short term, because we still, during the pandemic, as a global pandemic, COVID-19 might happening again. So we would need to look at how we can strengthen the policy on protecting the rights of the migrant.
ครับผมผู้แทนของกระทรวงแรงงานกรมการจัดหางานนะครับก็จากนี้ก็จะมาพูดเกี่ยวกับเรื่องของการใช้เกี่ยวกับการบริหารจัดการแรงงานต่างด้าวนะครับซึ่งตอนนี้เราใช้นโยบายตามภายใต้พระราชกำหนดการบริหารการจัดการการทำงานคนต่างด้าวพ.ศ. 2560แล้วก็มีแก้ไขเพิ่มเติมฉบับที่2พ.ศ. 2561นะฮะโดยรวมแล้วจะแบ่งกลุ่มต่างด้าวออกเป็น4กลุ่มนะครับก็จะมีประเภทกลุ่มแรงงานทั่วไปนะครับซึ่งจะเป็นระดับล่างหรือไร้ฝีมือกลุ่มที่2คือตลอดชีพนะฮะกลุ่มที่3คือชนกลุ่มน้อยอย่างเช่นชาวเขานะครับและสุดท้ายก็จะเป็นแรงงานประเภทฝีมือชำนาญการนะครับโดยปัจจุบันมีการออกใบอนุญาตทำงานไปแล้วทั้งหมดรวมทั้งสิ้นนะฮะรวมทั้งหมดก็ประมาณ2,482,256 คนนะครับโดยจะแบ่งจำนวนออกเป็นว่าเป็นกลุ่มทั่วไปที่เป็นระดับล่างไร้ฝีมือนะฮะก็รวมประมาณจำนวนประมาณ2,284,673 คนนะครับใน2ล้านกว่าคนเนี่ยก็จะแบ่งเป็นกลุ่มแรงงานกลุ่มพิสูจน์สัญชาติเดิม 1,374 นะครับแล้วก็กลุ่มแรงงานที่ได้รับใบอนุญาตให้เข้ามาทำงานตาม MOU นะครับก็ 847,224 คนแล้วแรงงานที่ได้รับอนุญาตตามมติครม. 4 สิงหา63,764 คนใน170,000เนี่ยนะฮะแบ่งเป็นแรงงานที่เข้ามาตาม MOU และกลุ่มแรงงานที่ผ่านการพิสูจน์สัญชาติ 139,910 คนแล้วก็กลุ่มแรงงานที่เข้ามาตามมาตรา64คือไปเช้าเย็นกลับตามแนวชายแดน 30,074 คนนะครับแล้วกลุ่มสุดท้ายก็เป็นแรงงานที่ได้รับอนุญาตตามมติครม.วันที่20 สิงหา62,266,011 คนใน1,200,000เนี่ยแยกเป็นกลุ่มที่ได้รับใบอนุญาตทำงานแล้ว 729,571 คน แล้วก็กลุ่มแรงงานที่อยู่ระหว่างดำเนินการยื่นขอรับใบอนุญาตทำงานตามขั้นตอนอีก 536,400 คนนะครับถัดมาก็จะเป็นกลุ่มที่2นะครับกลุ่มที่2ก็คือเป็นตลอดชีพมีเป็นใบอนุญาตทำงานตลอดชีวิตเราเป็นกลุ่มที่เก่ามากตั้งแต่ก่อนที่จะมีพรบการทำงานนะครับก็จำนวนมันจะมีแค่68คนในเมืองไทยตอนนี้นะครับแล้วกลุ่มที่3คือพวกชนกลุ่มน้อยนะครับพวกชาวเขาอะไรพวกนี้นะฮะก็ประมาณจำนวน 54,028 คนนะครับกลุ่มสุดท้ายก็จะเป็นกลุ่มที่มีฝีมือประเภทฝีมือนะครับเป็นระดับสูงช่างฝีมือผู้เชี่ยวชาญชำนาญการนะฮะก็รวมแล้วก็143,487 คนนะครับก็จะแยกเป็น2กลุ่มอีก2กลุ่มย่อยก็จะเป็นกลุ่มที่ได้รับส่งเสริมการลงทุนการนิคมปิโตหรือกฎหมายอื่นภายใต้กฎหมายอื่นนะครับอีกเป็น 42,131 คนแล้วก็เป็นกลุ่มทั่วไปเป็นนักธุรกิจช่างฝีมือชำนาญการทั่วไปเนี่ย101,356 คนนะครับประเทศไทยได้มีมาตรการป้องกันแพร่ระบาดดังกล่าวเนี่ยโดยความร่วมมือทุกภาคส่วนนะครับทั้งในเรื่องของการจำกัดการเดินทางการปฏิบัติตามข้อกำหนดของสาธารณสุขเช่นการล้างมือสวมหน้ากากอนามัยพวกนี้เป็นต้นซึ่งการดำเนินการดังกล่าวเนี่ยไม่ได้คำนึงแค่เฉพาะคนไทยนะครับก็จะหมายรวมถึงคนต่างด้าวด้วยนะครับทั้งที่เป็นแรงงานนะครับที่จะต้องปฏิบัติตามมาตรการที่รัฐกำหนดนะครับและถือเป็นข้อท้าทายในการบริหารจัดการแรงงานต่างด้าวซึ่งจำเป็นต้องสร้างความสมดุลระหว่างการปฏิบัติตามข้อกำหนดของหน่วยงานนะครับข้อกำหนดของหน่วยงานด้านสาธารณสุขกับการฟื้นฟูและสร้างเสถียรภาพทางเศรษฐกิจเพื่อแก้ปัญหาการขาดแคลนแรงงานของนายจ้างเพราะนายจ้างก็ยังมีความต้องการอยู่นะครับตรงนี้นะครับที่ผ่านมาเราก็เลยมีมาตรการให้สิทธิ์มีมาตรการในการช่วยเหลือดังนี้นะครับก็คือมันจะแบ่งเป็นสองกลุ่มนะครับกลุ่มระดับล่างกับกลุ่มระดับบนกลุ่มระดับล่างนี้เราก็จะดำเนินการตามมติครม.วันที่4 สิงหาคม 63นะครับตรงเนี้ยคือในเมื่อออกไม่ได้เข้าไม่ได้เราก็ให้ใช้คนที่มีอยู่นะครับเดิมนี่แหละนะครับให้สามารถอยู่ได้แล้วก็ทำงานได้จนถึงวันที่31 มีนาซึ่งในกลุ่มเนี้ยมันก็จะแบ่งเป็นทั้งหมด4กลุ่มนะครับก็จะมีกลุ่ม3 สัญชาติพม่าลาวเขมรนะครับทำงานตาม MOU ซึ่งวาระครบการ4 ปีการจ้าง4 ปีจริงปกติต้องกลับไม่ได้ก็ให้อยู่ต่อให้ทำงานได้ต่อนะครับให้ดำเนินการไปนะครับแล้วก็อันที่2ก็คือที่คนต่างด้าวที่เข้ามาทำงานตาม MOU ที่การอนุญาตทำงานสิ้นสุดเนื่องจากคือใบอนุญาตไม่หมดการอยู่ก็ไม่หมดแต่ว่าเนื่องจากสิ้นสุดเพราะเปลี่ยนนายจ้างนะครับไม่สามารถหานายจ้างได้รายใหม่ได้อะไรพวกนี้นะครับตามที่กฎหมายกำหนดอันนี้คือกลุ่มที่2กลุ่มที่3คือคนที่ถือบัตรผ่านแดน border pass เข้ามาทำงานตามความตกลงไปเช้าเย็นกลับนะครับตามแนวชายแดนนะครับหรือตามฤดูกาลแล้วกลุ่มสุดท้ายคือกลุ่มที่ผ่านการพิสูจน์สัญชาติแล้วนะครับแต่นายจ้างไม่ได้ดำเนินการเพื่อขออยู่ในราชอาณาจักรและทำงานต่อไปตามมติครม.เมื่อวันที่20 สิงหาคม 62นะครับซึ่งใบอนุญาตเขาจะหมดประมาณ30 กันยา 62ถึง30 ปี 63นะครับนี่คือ4กลุ่มตามมตินะครับที่ช่วยไปนะครับให้ซึ่งกรมการจัดการดำเนินการสิ้นสุดในวันที่31 ตุลาคมที่ผ่านมามันก็จะมีมติอีกตัวหนึ่งขึ้นมานะครับเพื่อมาช่วยในกลุ่ม MOU ครบ4 ปีนะครับก็คือมติวันที่10 พฤศจิกายน 63นะครับกลุ่มนี้มันก็คือหมดอายุ4 ปีคือหมดอายุในช่วงก่อนตุลา63นะครับเพื่อมาช่วยกลุ่มนี้อีกทีหนึ่งเพราะการหมดของ MOU มันไม่เท่ากันนะครับก็เลยมีการดำเนินการตั้งแต่วันที่1 พฤศจิกายน 63ถึง31 ธันวาคม 64นะครับซึ่งอันนี้ก็ต้องดำเนินการก็โดยกระทรวงมหาดไทยดำเนินการออกประกาศกระทรวงมหาดไทยเพื่อให้คนต่างด้าวประสงค์ทำงานในราชอาณาจักรต่อไปมีสิทธิ์ ขออยู่ต่อในราชอาณาจักรเป็นการชั่วคราวเพื่อปฏิบัติเพื่อทำงานได้อีกต่อไปอีก2 ปีนะครับส่วนกรมกระทรวงแรงงานโดยการจัดกรมการจัดการก็ดำเนินการรับคำขอต่ออายุจะเป็นการต่ออายุใบอนุญาตทำงานนะครับและออกต่อหรือออกแล้วแต่กรณีนะครับโดยนายจ้างโดยโดยนายทะเบียนพิจารณาออกอนุญาตการทำงานตามระยะเวลาที่คนต่างด้าวร้องขอไม่เกิน2 ปีซึ่งเป็นการดำเนินการตามกฎหมายของเราที่มีอยู่ตามปกตินะครับจะเป็นการต่อนะครับดำเนินการตั้งแต่1 พฤศจิกายน 63 ถึง 31 ธันวาคม 64 นะครับแล้วก็ตัวสำนักงานตรวจคนเข้าเมืองก็ดำเนินการตัวลงตาต่อไปอีกไม่เกิน2คือต่อได้2 ครั้งละไม่เกิน1 ปีนะครับ
For our central focus of our research, we wanted to highlight how the migrants make decisions despite all the challenges. And we felt that there's currently limited insight into migrants' pandemic decision-making, and we thought that there's a need for better understanding to inform policy-making. And in order to understand the ways migrants from Myanmar and Cambodia actively negotiate the present crisis and to inform policy response, we formulated the following research questions. First, what decisions are migrants taking due to the pandemic and what factors do they consider? 2, how do labor migration and social protection frameworks shape migrant choices? 3, what lessons can be learned from migrant decision-making during the pandemic to improve labor migration and social protection policy in both the short and long term? As I mentioned, so in the research, we are treating migrants as social actors who actively make decisions. Preliminary findings among the migrants who have stayed in Thailand throughout. Firstly, family considerations are a major factor in deciding whether to stay in Thailand or return to countries of origin. I never really considered returning. It's not a realistic option. I have 3 children, all born in Thailand. They speak Thai and have no roots in Myanmar. Economic factors also hold significant weight in determining whether to stay or go. Male Cambodian migrant working in seafood processing in Samut Prakan said, I want to be able to remit money to my family, so I decide to continue working in Thailand. Border closures and cost as a barrier to return was also highlighted. Female Myanmar migrant who's currently unemployed in Samut Prakan said, I want to leave Thailand to take care of my family, but I can't because of the border closures and the expense of traveling. Health considerations were also pointed out. Female Myanmar factory worker in Samut Prakan said, in Thailand, they have better disease control system. Among migrants who have gone back to Cambodia and Myanmar, there are several also factors that they considered. One of the factors is that the employers reduced their salaries, cut hours, or made redundancy. Cambodian returnees said, my work was gradually reduced day by day. That's why I decided to return home. There was also a case where employers encourage and or facilitate their migrant workers return to countries of origin. Male Myanmar returnee who has worked in agriculture in Thailand said, my employer gave me permission to return home for 1 month. He arranged the bus and covered the cost, 1,500 baht from Suratani to Meso. Migrants in some cases were forced to return clandestinely as employers confiscated immigration documents. Cambodian returnees said, my employer withheld my border pass. I came back with other returnees. I paid 1,500 baht to an agent. Once I got near the border, I had to walk through the jungle. Lack of clear information on the situation and social protection available to them in Thailand also influenced some migrants in their decision to return. Myanmar returnees said, if I had received clear information about the border closure, I don't think I would have come back. Other returnee in Myanmar said, if I had known I could apply for the unemployment benefit in Thailand, of course I would. Of course I would have most likely stayed in Thailand. As conclusion, I'd like to point out 3 points. Firstly, migrants' decisions are based on a complex range of factors, as you could see, including family needs, economic necessity, health concerns, sense of belonging, practical considerations such as the border closures, and future hopes and aspirations. Despite challenges, migrants generally have positive views of Thailand and wish to contribute to the Thai society. For effective policy to be implemented, policymakers need to better understand needs of migrants and strive to make policies that are more cohesive.
လက်ရှိမှာတော့ကျွန်မအလုပ်မရှိပါဘူးဒီကိုဗစ်ကာလမှာစက်ရုံကအလုပ်ထုတ်ခံရတာ3လကျော်လောက်ရှိပါပြီ
So currently I have no job because I was forced to quit my job like since 3 months ago.
ကျွန်မတို့အလုပ်ထုတ်ခံရတာကျွန်မတို့စက်ရုံက136ယောက်ရှိပါတယ်
It wasn't only me that forced to quit the job. It was around 136 workers who has to quit the job.
ဒီကိုဗစ်ကာလဖြစ်တော့ကြောင်ပေါ့နော်စက်ရုံကအလုပ်သိရှာရတာခက်ခဲတယ်ကျွန်မတို့စက်ရုံကလည်းအဲ့လိုအခြားစက်ရုံတွေမှာအလုပ်ရှာဟိုခက်ရင်အောင်ပေါ့နော်ဟိုဓာတ်ပုံတွေအဲ့လိုမျိုးပို့ထားတာတို့နာမည်စင်းတွေပို့ထားတာလည်းရှိပါတယ်
It was very difficult like to find a job to find a new job during this COVID period, and then the employer also kind of blacklist us and then sent our name list to other factory like so that we cannot find the job in a new factory easily.
ကျွန်မတို့ကဆန္ဒပြပြီးတော့အလုပ်ထွက်သွားတယ်ဆိုပြီးတော့ဗောနော်
So the employer claimed that we protest the factory, so we are the protester of the factory, so they blacklist us like that.
အလုပ်ထုတ်ခံရတဲ့အကြောင်းကတော့ကျမတို့လုပ်ခဲ့တဲ့စက်ရုံကဆိုရင်ပေါ့နော်တရားဝင်လောက325ပဲလည်းမရှိပါဘူးပြီးတော့300ခိုင်နှုန်းကြီးဖြတ်တယ်ပေါ့နော်ဘာကြောင့်ဖြတ်လဲလို့မေးကြည့်တော့သူတို့ပလိတ်ကြီးပေးတယ်လို့ပြောပါတယ်ဘဏ်ကတ်တွေလည်းသိမ်းထားပါတယ်အခါကြီးကြီးတွေဆိုလည်းပိတ်မပေးပါဘူးတနင်္ဂနွေရက်တွေဆိုရင်လည်းပိတ်မပေးပါဘူး
So the reason that we were forced to quit the job is because we were planning to make a complaint about the minimum wage and then working out and then the 3% that have been deducted through our salary, which they give the reason that this is for the fees for the police, and then the other reason is they keep our bank book. And then another reason is we didn't have the day off. Even Sunday, we don't have the day off.
ကျမတို့ကတရားဝင်လောကရရှိဖို့အလုပ်သမားတွေရဲ့အခွင့်အရေးပြေဝရရှိဖို့ပေါ့နော်တောင်းဆိုဖို့တိုင်မင်းနေတော့ပေါ့နော်အဲ့လိုမျိုးစက်ရုံကတည်းတိသွားပြီးတော့အလုပ်ထုတ်ခဲ့တာပါ
So during the process of planning to make the complaint, the employer found out. So that he forced us to quit the job.
ဒီအလုပ်ထုတ်ပြီးတဲ့အချိန်မှာလဲစက်ရုံအဆောင်တွင်းမှာပေါ့နော်ငှားနေတဲ့အလုပ်သမားတွေကိုဆိုရင်လည်းအဲ့လိုမျိုး9ရက်အတွင်းကိုစက်ရုံအပြင်ကိုအပြီးပြောင်းခိုင်းပါတယ်
So the employer told us to leave the accommodation that they provided within the 7 days.
ကျမတို့လည်းအဲ့လိုမျိုးပေါ့နော်ဈေးသက်သာတဲ့အခန်းတွေမှာရှာပြီးတော့ငှားနေရပါတယ်
So we have to find the accommodation that is cheaper than before, and then we have to coping with living in the cheaper accommodation.
ဒီမှာတော့ကျမအလုပ်မရှိပါဘူးဒီကိုဗစ်ကာလမှာစက်ရုံကအလုပ်ထုတ်ခံရတာ3လကျော်လောက်ရှိပါပြီ
So currently I have no job because I was forced to quit my job like since 3 months ago.
ကျမတို့အလုပ်ထုတ်ခံရတာကျမတို့စက်ရုံက136ယောက်ရှိပါတယ်
It wasn't only me that forced to quit the job. It was around 136 workers who has to quit the job.
ဒီကိုဗစ်ကာလဖြစ်တော့ကြောင်ပေါ့နော်စက်ရုံကအလုပ်သိရှာရတာခက်ခဲတယ်ကျမတို့စက်ရုံကလည်းအဲ့လိုအခြားစက်ရုံတွေမှာအလုပ်ရှာဟိုခက်ရင်အောင်ပေါ့နော်ဟိုဓာတ်ပုံတွေအဲ့လိုမျိုးပို့ထားတာတို့နာမည်စင်းတွေပို့ထားတာလည်းရှိပါတယ်
It was very difficult like to find a job to find a new job during this COVID period, and then the employer also kind of blacklist us and then sent our name list to other factory like so that we cannot find the job in a new factory easily.
ကျမတို့ကဆန္ဒပြပြီးတော့အလုပ်ထွက်သွားတယ်ဆိုပြီးတော့ဗောနော်
So the employer claimed that we protest the factory, so we are the protester of the factory, so they blacklist us like that.
အလုပ်ထုတ်ခံရတဲ့အကြောင်းကတော့ကျမတို့လုပ်ခဲ့တဲ့စက်ရုံကဆိုရင်ပေါ့နော်တရားဝင်လောက325ပဲလည်းမရှိပါဘူးပြီးတော့300ခိုင်နှုန်းကြီးဖြတ်တယ်ပေါ့နော်ဘာကြောင့်ဖြတ်လဲလို့မေးကြည့်တော့သူတို့ပလိတ်ကြီးပေးတယ်လို့ပြောပါတယ်ဘဏ်ကတ်တွေလည်းသိမ်းထားပါတယ်အခါကြီးရဲ့ကြီးတွေဆိုလည်းပိတ်မပေးပါဘူးတနင်္ဂနွေရက်တွေဆိုရင်လည်းပိတ်မပေးပါဘူး
So the reason that we were forced to quit the job is because we were planning to make a complaint about the minimum wage and then working out and then the 3% that have been deducted through our salary, which they give the reason that this is for the police, the fees for the police, and then the other reason is they keep our bank book. And then another reason is we didn't have the day off. Even Sunday, we don't have the day off.
ကျမတို့ကတရားဝင်လောကရရှိဖို့အလုပ်သမားတွေရဲ့အခွင့်အရေးပြေဝရရှိဖို့ပေါ့နော်တောင်းဆိုဖို့တိုင်မင်းနေတော့ပေါ့နော်အဲ့လိုမျိုးစက်ရုံကတည်းကတိသွားပြီးတော့အလုပ်ထုတ်ခဲ့တာပါ
So during the process of planning to make the complaint, the employer found out, so that he forced us to quit the job.
ဒီအလုပ်ထုတ်ပြီးတဲ့အချိန်မှာလည်းစက်ရုံအဆောင်တွင်းမှာပေါ့နော်ငှားနေတဲ့အလုပ်သမားတွေကိုဆိုရင်လည်းအဲ့လိုမျိုး9ရက်အတွင်းကိုစက်ရုံအပြင်ကိုအပြီးပြောင်းခိုင်းပါတယ်
So the employer told us to leave the accommodation that they provided within the 7 days.
ကျမတို့လည်းအဲ့လိုမျိုးပေါ့နော်ဈေးသက်သာတဲ့အခန်းတွေမှာရှာပြီးတော့ငှားနေရပါတယ်
So we have to find the accommodation that is cheaper than before, and then we have to coping with living in the cheaper accommodation.
ကျွေးတွေလည်းများလာတယ်ပြီးတော့စာဝတ်နေရေးပြည်လဲအောင်ပေါ့အဲ့လိုမျိုးပြောင်းလိုက်ချိုးတာတို့စက်သွန်စီးတာတို့အဲ့လိုမျိုးကြံခုတ်တာတို့စပားရိတ်တာတို့လုပ်ရပါတယ်
we are more in depth, and then we have to find the available job that is available in anywhere. Like I work in the corn plantation, and then the onion plantation, and the sugarcane plantation, and I also do the harvesting in the farm.
ယောက်ျားလေးတွေကတော့ဗောနော်အလုပ်ကျန်းနေလို့မျိုးလုံနိုင်ပြီမဲ့မိန်းကလေးတွေကတော့မလုံနိုင်ပါဘူးဒါပေမဲ့လည်းလိုက်လုံနေရပါတယ်
Like these works are a kind of a difficult work, so it is easier for a man to get this job, but for the woman it is difficult. But somehow for our survival, we have to work anyway.
အလုပ်ကလည်းနေ့တိုင်းတော့မရှိဘူးဗောနော်ရှိတဲ့နေ့တော့အလုပ်မရှိရင်တော့နားရပါတယ်
Even these difficult jobs are not available every day. Like we can just get it Sunday, and then the other day we don't have the work.
ကျမတို့စီအိုင်းစာအုပ်ကန်ဆောင်ထားတဲ့လူတွေကတော့ဗောနော်ပကာဆန်ကွန်ရပါတယ်ဒါပေမဲ့အပြေးဝမရပါဘူးပထမတစ်လထုတ်တာမှာ2000ပဲရပါတယ်ဒုတိယလမှာ9600ပဲရပါတယ်
So for those who have CI like me, we get the Social Security fund, but not fully. We got like in the first month we got 2,000 baht, and then in the second month we got 5,000 baht.
ကျမတို့ဘောနော်ကူညီပေးနေတဲ့အဖွဲ့အစည်းတွေလည်းရှိပါတယ်အဖွဲ့အစည်းတွေကဘယ်လိုကော HRDF တို့ AWO LNC အဖွဲ့အစည်းတွေကအဲ့လိုမျိုးအဲ့လိုထိုင်းနိုင်ငံအဲ့လိုချက်ချင်ကြီးအဖွဲ့တွေရှိမှအကူအညီတွေတောင်းပေးပါတယ်
So during this outbreak, we also get the support from the other organizations like HRDF, AWO, LLC, those who are finding the donation for us from the Thai Red Cross. So far we have got 2 times of the support from them already.
ဒီထိုင်းကချက်ချင်ကြီးအဖွဲ့အစည်းတွေရှိရအကူအညီရတာ2ကြိမ်ရှိပါပြီ
Yeah, it's been 2 times that we got the support from the Thai Red Cross.
အလုပ်ထုတ်လိုက်ပြီးမှလည်းလို့ပေါ့နော်အလုပ်သမားတွေစီကနေပြီးတော့လာစားတွေကနေစီအိုင်းစာအုပ်တက်တန်းတိုးဖို့ဆိုပြီးတော့ပတ်စံတွေဖြတ်ထထားရေးလဲကိုပြန်မပေးပါဘူးပေါ့
So before we quit the job, we have to the employer deduct the money for our people extension, and then when we quit the job, they didn't return any of that they have been deducted from our salary.
ဒီအလုပ်ထုတ်လိုက်တဲ့အချိန်ကပေါ့နော်ဟိုစာအုပ်တက်တန်းတိုးရမယ့်အချိန်ဖြစ်တာကြောင့်မလို့အလုပ်သမားတွေကပတ်စံမရှိတာတွေနဲ့ရောတထေးမရှိတာတွေနဲ့ရောတော်တော်ဒုက္ခရောက်ခဲ့ရပါတယ်ပေါ့
So the time that we quit the job, it was the time that we also have to extend our document. So it is very difficult. Like the problems come in the same times, and then we don't have the employer as well.
တချို့အလုပ်သမားတွေကပေါ့နော်အဲ့လိုမျိုးပတ်စံတွေချင်းငါပြီးတော့အဲ့လိုမျိုးပွဲစားတွေနဲ့စာအုပ်တွေကိုတက်တန်းတိုးရပါတယ်ပေါ့
For other worker, like they have to hire the broker to extend their document.
ပတ်စံမတက်နိုင်တဲ့လူတွေကတော့စာအုပ်တွေကိုအသေးခံလိုက်ရပါတယ်
And some those who don't have money or those who cannot afford, then they have to let their document expire like that.
ကျမတို့လည်းပွဲစားနဲ့စာအုပ်ကိုတက်တန်းတိုးထားရပါတယ်ပေါ့
For me, I also have to hire the broker to extend my document.
မြန်မာပြည်ကိုမပြန်နိုင်သေးတော့စာအုပ်တွေကတက်တန်းရှိနေမှာဖြစ်မှာမို့လို့ပါ
Because currently I cannot go back to Myanmar yet, so I need to extend my document.
အလုပ်ထုတ်ခံလိုက်ရတော့မြန်မာပြည်မှာရှိတဲ့မိဘတွေစီကိုလည်းပတ်စံပို့ပေးနိုင်တော့ပါဘူးပေါ့မိဘတွေလည်းပဲအဆင်မပြေတော့ဘူးပေါ့နော်အကျွေးတွေများလာတယ်
Because I don't have the job anymore, so I cannot send back any remittance to my family. So they are also facing the problem as well.
ကျမတို့ပတ်စံပို့မှာပဲစောင့်နေတယ်ပေါ့နော်
So they are also waiting for their money that we will be sending them back.
ဒီကိုဗစ်ကာလမှာအလုပ်ထုတ်ခံရတော့မြန်မာပြည်ကိုပြန်ဖို့ပေါ့စဉ်းစားပါသေးတယ်ပေါ့နော်မြန်မာပြည်ကိုပြန်ရင်လည်းအဆင်မပြေလောက်ဘူးပေါ့နော်
I did reconsider to go back to Myanmar, but then I realized that even I go back, there will be no job for me in Myanmar.
မြန်မာပြည်ရဲ့မှာလည်းယောဂအခြေအနေတွေကစိုးနေတယ်ပေါ့နော်ပြန်တော့လည်းဘာလို့စားမှန်းမသိတော့ဒီထိုင်းမှာပဲဆက်နေပြခဲ့ပါတယ်
And the health condition in Myanmar is also getting worse. So I don't want to go. I don't want to go back, and then I continue staying in Thailand.
ဒီထိုင်းနိုင်ငံမှာကျတော့ပတ်စံရှာရတာလွယ်ကူပါတယ်ပေါ့တရက်အလုပ်လုပ်ပြီးလို့ရှိရင်နောက်တရက်အလုပ်မရှိရင်လည်းပဲနောက်တရက်စာထိုင်စားလို့ရသေးတယ်ပေါ့
And I could say that being in Thailand is easier to get the job. Like even I work for one day, like I can survive for another day with the income that I got from that one day.
So talking about the impact of the COVID-19 on the Cambodian migrant worker, and this more forecast the Cambodian migrant worker who migrate to Thailand. Until now, it's more than 100,000 Cambodian migrant workers already returned from Thailand by land to Cambodia from March until December. I think the mass return during the border measure, the border closing measure, I think is maybe started in March, later in March by the government of Thailand. So the people, the migrants scaring us fear, and then they decide to return back. In addition, also another reason that the migrant also inform us, they also lost job during the COVID-19. A lot of jobs have been lost. The factory closed, especially for a small factory, for the house, for a household work. Some migrant workers is also complain about overstay. Their document is expired and they cannot extend their document anymore. Unfair dismissal and termination of contract is also, they inform us when they return back to the country of origin. They say that the employer terminate the contract and just ask them to return back to Cambodia, and the employer promised that they will call the worker again when the situation of the COVID-19 is improved. And some case, the migrant is also said that they want to reunify the family. During the COVID-19, they want to be away each other. But due to the COVID-19, it's also some migrant families are also challenging with the livelihood issue. So when they return, so as you know, remittance is very important for the families in Cambodia. So the families in Cambodia is really depend on the remittances. But due to the COVID-19, the migrant lost job, the migrant lost income. So that's a big issue for the family in Cambodia. Some family is also challenging with the livelihood. They do not have enough food, enough crop to survive, water, also the water to drink. And that is really significant because I think majority of the family in Cambodia is also have debt. And then they rely on the remittance to repay the debt, to repay the debt to the microfinance or to the private money lenders in Cambodia. So those are the impact and also the situation of the COVID-19. During the COVID-19, the Royal Government of Cambodia also created a fund to support the vulnerable group. So the word vulnerable group is not really clearly defined who is the vulnerable group. But however, the government will refer to the poor identity. Poor identity, yes, you have the poor identity 1 or poor identity 2. It depends on the region where you live in. So it's the government only define like this. However, the migrant worker will be challenging to access such a government fund support because the migrant worker are on the move and they never has such document to prove the government and to entitle the government fund or cash subsidized by the government to the vulnerable. This is one thing. Another initiative is the National Committee to Combat Human Trafficking in Cambodia is also working with the UN agency to launch a project to support the migrant returnee. So the support is included health education, health prevention measure, livelihood program, emergency relief, so many things that they provide. But the program is only cover for 5 provinces, not the nationwide in Cambodia. However, at the border areas, the government is also working with IOM, International Organization for Migration, and other international NGOs, and with border police to ensure that the migrant worker was returned from Thailand was properly screened on COVID-19. So they conduct what we call a temperature measure to make sure that if your temperature is not higher than 37.5%. Okay, so if you have any symptom like cough and your temperature is higher, then you will the migrant worker will stop and then will keep in the health center and the quarantine center at the border. But if you do not have any symptom, they will allow you to return back to Cambodia, but you need to stay in the government quarantine center for 15 days. And the situation is really bad, in the quarantine center because the facility is not good. There is not enough material. There is not enough food and drinking water. And also the electricity. That is the problem. And most of the migrant workers never want to stay in the quarantine center and they want to stay in the family. But however, the government said that you cannot go to the family because it's a part of the prevention of the COVID-19 widespread. The government is also provide free transportation for the migrant worker from the border area to the province. First, my recommendation will be go directly to the Cambodian government. So this is something that the government should do to have to provide the support to migrant workers, such as with package, including food, PPE kit, information and financial support of Kazakhstan. This is really important and really need. If you go to visit the return family, they has a problem with all the situation and they really need to support the family. Second thing, during the waiting time, I think right now the migrant workers are not sure when the border is reopened and when they can return back to Cambodia. So they are really uncertain right now. So my recommendation is also to the government that maybe during the waiting time, the government should provide the skill training or upskill training to the returnee. So very important, and when they return back to Thailand, they have a more skill to work. My second recommendation also regarding to the financial support. I think they are really important for those returning. They really need the financial support. As you know, most of them rely on the remittance, but right now they do not earn remittance anymore, so they need to have another way to support by the government. And the government is also need to provide clear information on COVID-19 to the migrant worker, especially to the return community. This is really important. So when they return back to Thailand, they know how to prevent themselves from COVID. Another recommendation that I think that is still gap because from the experience that we learned during the COVID-19, the government do not have very clear plan to respond the impact of COVID-19 among the migrant population. And I think this is really important. In the future pandemic, the government should have very clear plan, emergency plan to respond this. Otherwise, the migrant worker will challenge the same issue. Cross-border mechanism for repatriation, the survival of impediment or the migrant return, I think really important. So from the situation that we observe, during the border closure, many migrant workers return to Cambodia. Even Thailand said that it's the border closure, that the migrant workers still continue to return, and a lot of migrant workers just cross the river, cross the mountain to return back to Cambodia. And then if we think that we use the border closure as the way to prevent the outbreak, then I do not think that is very effective in a way why the migrant worker can freely return back without support from each government. Otherwise, if the one migrant worker have a COVID-19, then they can spread to the other. So I think this is really important. And from such experience, we should have both governments should create a repatriation, proper repatriation system that can help to stop the widespread pandemic and also to respect the right and benefit of the migrant worker. I think lastly, that's really important one. Cambodian and Thai government should work together to waive the visa and work permit additional fee. I think many migrant workers and that we talked to, they said that they return back to Cambodia with a valid visa, and if they want to return back to Thailand, they are not sure if the government of Thailand will charge again the visa fee or not. So, and the other is also for those who already stay in Thailand, but they do not have job, they do not have income, and how they can afford for the visa and work permit fee. So I think this is very clear that the government of Thailand should waive to the visa fee and work permit condition, additional work permit cost in Thailand.
So my presentation is called Don't Leave Migrants Behind, because Thailand had a policy called Leave No One Behind, but we know that there were some gaps. Registration status. COVID precautions wreaked havoc on the migrant registration system. There were major deadlines that passed and were extended and passed and were extended again, oftentimes the extension only coming at the last minute. Although there were extensions to other registrations besides the MOU, such as the CI and border pass known as Section 64, Matra Hoksipsi, many migrants still fell out of the system and became undocumented or partially documented. Those who have become undocumented are concerned about the cost of going back or having to become an MOU worker. Some of the support provided by the Thai government and its limitations, as has been mentioned, migrants who had Social Security generally were able to receive unemployment benefits if they stayed in the country. Some felt discriminated against, though, because they received less than Thais, and the claims process was difficult to navigate, especially because of the language and the time it took. Others did not receive unemployment benefits because the Social Security office saw that these people were still working part-time. If you were working part-time, you were ineligible. So migrants who were undocumented or not registered with Social Security, this included some with 10-year card, the border pass, and informal sector jobs in agriculture or domestic work, or their employers were unwilling to enroll them in Social Security, or were not MOU workers, so there was a large category of workers who were ineligible for Social Security, did not receive any government benefits. I'd like to reiterate that here in Thailand, some of the countries of origin governments had a limited response for their workers here in Thailand. So from Cambodia and Myanmar specifically, migrants said that these governments should have provided support to migrants with aid packages, including food, PPE, which is the personal prevention equipment, information and financial support or cash subsidies, especially because they weren't receiving this from the Thai government. The Myanmar government, perhaps the labor attaché, should have negotiated with employers to ensure that they take care of their workers. The Myanmar government should also have provided clear information about the quarantine process for those who returned home. Now, some recommendations for the next lockdown, or lessons learned from the first wave. To the Royal Thai government as a destination country, we feel that the relevant authorities, especially Ministry of Interior, Ministry of Labor, and Ministry of Public Health, need to have a comprehensive cabinet resolution that works towards cohesive policies and levels off a similar understanding to ensure that all migrants, including undocumented migrants, are protected from COVID-19 and receive necessary support to survive the pandemic downturn while de-emphasizing the enforcement of immigration policies. We also feel increase information about policy changes and make them more accessible to migrants. Provide employment assistance, so pass special measures to facilitate extensions of visas and work permits, and provide amnesties for those who have fallen out of the system. Labor rights still need to be fully protected because labor rights are still being violated. That includes ensuring employers fully compensate migrant workers who've been laid off, and also to make the complaint system easier to access, because right now it can only be accessed through, or during the lockdown and other measures immediately following. The labor complaint system could only be reached through the internet and in Thai language. Allow migrants greater flexibility in employment. For example, easing restrictions which prohibit migrants from switching jobs and allow them to take up extra work. Right now, we still have the single employer policy, which is unreasonable. Assist migrants still in the country to find work and help reskill them, because we see that they're switching jobs. Pursue responsive and appropriate financial relief measures that benefit all migrant workers who face unemployment or underemployment, especially because many of these people have families and they have children that they're taking care of. Ensure that those who are enrolled in Social Security are able to access the benefits that they are entitled to. Prevention, we still need public information campaigns aimed at migrants to inform them of important matters relating to the COVID-19 pandemic, including prevention, detection and treatment, and all this should be in appropriate migrant languages as necessary. The Ministry of Public Health and Ministry of Labor need to recognize and strengthen the migrant health volunteers as a first line of defense. And we need to emphasize a public health and humanitarian response for border crossers, with efforts geared towards providing affordable quarantine and health check measures at border entry points, rather than treating them solely as illegal entry. Relief, we need to ensure that all migrants, including those without MOU status, receive assistance from governments, and that relief is sufficient to support family members, dependents, and children. I think I just said that. The Thai government and country of origin governments need to distribute relief packages of food, PPE, and sanitary equipment to migrant workers and their families through collaboration with NGOs and CBOs. As we saw, the Red Cross is an example. They can help provide this sort of access, as well as our NGOs that work on the ground on a regular basis with migrants. Many migrants have gone into debt and to survive, in order to survive, and need some sort of debt relief program. Rent and utilities are regular expenses that are difficult to cover in their current situation. So this is to both countries to work more in collaboration, urgently work towards the portability of social security systems, and actively reach out to migrant communities to inform them of their entitlement and facilitate their access to benefits. As we saw, some migrants found out that they were eligible only after they had returned home, and then were therefore unable to access the benefits. strengthen the support and strengthen the support provided by diplomatic missions and labor attachés, including increased information dissemination through various channels, especially the internet, Facebook, respond to inquiries and reports from migrants, and increase capacity of embassies and consulates to provide support services. To donors, for example, governments of the US, EU, Japan, work closely to ensure that the COVID-related funds that are provided to the countries of origin are properly managed, and that these funds reach migrant workers regardless their legal status in both origin and destination countries. And a final thought is that the findings generally point to the current lack of policy cohesion, lack of integration of policies, there's still social exclusion of migrants, and absence of effective information dissemination mechanisms. All the issues that have existed for decades, but all these issues have existed for decades, but the impact has been exacerbated during COVID-19, as we've seen around the world that the most vulnerable populations are exposed more than others. And finally, it is clear that many migrants see Thailand as their home or their place, but migration policies still treat them as a temporary labor force. How can we change this?
จุฬาลงกรณ์นะครับนั่นขอตัวเลขนะครับผมอยากจะถามว่ามีแรงงานพม่าเนี่ยที่อยู่ในไทยกลับไปพม่านะครับกี่คนและในจำนวนนั้นนะครับสามารถกลับเข้ามาในเมืองไทยได้หรือไม่แล้วคิดว่าในอนาคตแล้วเนี่ยแรงงานที่กลับไปพม่าเนี่ยแล้วไม่สามารถกลับมาเราจะทดแทนได้อย่างไรนะครับนั่นเป็นประเด็นแรกนะครับประเด็นที่สองเนี่ยน่าสนใจมากตัวเลขที่ท่านให้มาเนี่ยถ้าดูแล้วนะครับไม่ทราบว่าในอนาคตนะครับประเทศไทยจะสามารถเนี่ยให้ความคุ้มครองแรงงานเนี่ยที่ท่านให้ตัวเลขมาทั้งหลายเนี่ยได้ดีแค่ไหนนะครับคือผมอยากจะเรียนถามว่าประเทศไทยทำอะไรมากกว่านี้ได้ไหมนะครับ
The question is from Miss Jackie Pollock. She's with the International Labour Organization from Myanmar. She said, thank you for this presentation. She would like to ask the representative from Department of Employment, Ministry of Labour of Thailand, of all the different categories of the migrant status that you were outlined, which categories can contribute to social security, and is it mandatory for employer of migrants in those categories to register the migrant workers in the social security system?
จากที่ท่านอาจารย์ที่ถามประเด็นที่ว่าจำนวนที่ผมเนี่ยผมให้ได้แต่ที่ว่าจำนวนกลับออกไปเนี่ยไม่มีตัวเลขยังไม่มีตัวเลขที่ชัดเจนนะฮะมันประมาณ72,000 กว่าคนไม่ทราบเคยประสานกับทางสำนักงานคนเข้าเมืองนะว่าประมาณมีแรงงานที่เป็นมากกลับไปเท่าไหร่ประมาณ100,000ที่ประสานกับตมที่ประสานกับตม
70,000 to 100,000.
ครับแล้วก็ในส่วนที่ว่ากลับไปแล้วจะเข้ามาตอนนี้อยู่ระหว่างเจรจากับประเทศต้นทางอยู่นะฮะอยู่ระหว่างการพูดคุยกันอยู่ว่าจะเข้ามายังไงแล้วก็ต้องเป็นไปตามนโยบายของรัฐบาลที่ว่าจะต้องเปิดด่านเปิดชายแดนก่อนนะตรงนี้นะฮะอยู่ระหว่างก็คุยกับหน่วยงานที่เกี่ยวข้องด้วยสบคด้วยอะไรเงี้ยนะครับจริงๆอยู่ที่รัฐบาลนะเพราะว่าชายแดนที่ว่าตอนนี้พม่าก็ระบาดหนักขึ้นเรื่อยๆก็อาจต้องใช้เวลานะเราไม่สามารถทำเราพร้อมแล้วทางต้นทางก็พร้อมแต่ว่าปัญหาตอนนี้ติดที่แค่เปิดเข้ามาเท่านั้นเองตอนนี้อยู่ช่วงนี้ครับ
My second question go to Mr. Abram. I mean very good. Thank you very much. Can you list 3 priorities? You have given a lot of tons of recommendation. My goodness. But can you list 3 top priorities that the Thai government can do at this time, at this moment? And my second question to you, can you give me a comparison perspective of what other country has done in ASEAN? For example, country that also have a lot of migrant workers, Malaysia or Singapore. Just a little bit of perspective. Thank you so much.
Three priorities, I would say. First is that migrants who are undocumented or partially documented are very concerned about their status. So there should be some form of amnesty or as has been mentioned, perhaps free cost of registration. The second would be allowing migrants to take up more jobs and having actual job placement for these migrants who are here currently and are underemployed. And the third one is that a lot of migrants are in debt, as I've mentioned. So there should be some form of subsidy provided to these workers to help them get past their immediate debt. They've been going into debt with local vendors and others. The money that they do get goes to the standard costs of rent, etc. So I think those are the three priorities that I would set out. I would ask our representative to maybe provide her own input as well. But first, let me answer your other question about comparison to the other countries. I would say that Malaysia has been a very bad player in respect to the COVID crisis. They rounded people up and sent them home. Just recently, the Top Glove factory, which makes the surgical gloves, is considered a hot spot. So they've taken very few precautions, and the ones that they have taken have been extremely exclusionary by sending people home. Singapore has done a bit better. They originally didn't fare so well, as they focused on their own population first and foremost, and then the migrant camps became hotspots. But once they realized that, they did remedy the situation. So in that respect, Singapore has responded well. So I would say that Thailand is probably definitely better than Malaysia, and somewhere a little behind Singapore, just because there are so many more undocumented migrants here in Thailand, and if they're not in the system, they're not really provided assistance. So I think that's the main gap with the Thai response.
Yeah, thank you very much. And I think I just only add the priority that Bram raised. I think is really important. And one thing that we really need to make it happen is about the portability of the social protection. I think that is really important. Why the migrant workers who are working in Thailand and they cannot bring back all their benefit in Thailand. So this is something really important. If the system is working now, so the migrant worker who already returned to the home country, they can use such a fund to support their livelihood. Yeah, this is in addition to Bram what he said. Thank you very much.
The point that Sokchan mentioned earlier about, also actually Bram mentioned about how do we prepare? Bee also mentioned, how do we prepare for the future pandemic and also future migration governance policy? And one immediate thing that we should look at is, so one thing that we've been speaking over and over is the cohesion of policies across the immigration policy to labor policy and family related matter to health issues. Because without it, it's very, very difficult and nearly impossible to tackle the pandemic and go over the crisis. And the most immediately, I think one thing that we need to think about is when the vaccination starts being implemented, is Thailand going to include all the migrants, regardless of their migration status, for the free vaccination service? I would like to believe that that would be the case, because I think the Thai authority, of course, very much know that without including everyone and leaving no one behind, no vaccination would be effective and pandemic would not be stopped. Thank you.
Hello, I'm Laure Sigel, a French journalist in Bangkok, and I wanted to ask you, there seems to obviously have a massive disruption of the workforce in Thailand, and do we know what kind of impact this had very concretely on the Thai economy, the fact that all these workers were working in very important industry here were not here or couldn't work or were fired, and what kind of impact it had on the national economy here?
I think that the migrant workers being laid off is a reflection of the impact on the economy. So the service industry, especially hotels and restaurants, have been very severely hit. And many of those people are the workers who returned home because they didn't foresee any income. Many of the establishments shuttered their doors. John, our photographer, was down in Phanga and said he saw 5-star resorts shuttered. And so, one after the other all along the beach. So if tourism is a major industry here in Thailand, then you've seen that is a very clear hit to the economy. And then there's a knock-on effect to that because migrants are customers of many of the local vendors as well. So you can see that there's a ripple effect, that they're taking on debt, in fact, in order to feed themselves. We don't know how that will play out in the long run, but we've heard that personal debt is growing exponentially here in Thailand. It was an issue before COVID, and now it's probably expanding to the migrant population as well as the Thai population.